Let's start again. Hello and welcome to another Q&A. Technology is wonderful. It
It
says
is.
internet
It
connection
is.
is unstable. I've had issues with my internet
That's all right. You're back now.
the
That's the
last two
main
days,
thing.
which is the main
We'll
thing.
blast through it. We'll get you done. Your computer's
Yeah,
done for Friday.
we can. Yeah, I've been busy working since 7 this morning, so just
Oh,
finished and got this now, and then I can go and have some tea, and then hopefully, fingers crossed, a quiet weekend. Date night tomorrow night.
amazing. There you go. We'll get
We,
through it.
we're going to play crazy golf in a place called Glory Holes of all places.
Oh, nice.
It
Very nice.
is
I
a
bet that'll be
crazy.
fun.
It is definitely a crazy golf course and nothing else.
Now we
With
know what Will does at the weekends, everyone.
yeah, well, we're playing crazy golf. Cool. We'll go straight into we've got a mixture of questions from my stories and from the Q&A forms. So I'll let you be question master again.
We do. So, number one is any tips to reduce stubborn belly fat, which is a question that I think comes up a lot.
Yeah.
And a lot of various companies will try and advertise their various ways to do so. But what is the correct answer?
There's loads of things on. I mean, the latest one that I've seen is, I think it's been on for a while. There's like an exercise where you can suck your stomach in and then blow it out again, and that helps tone up, flatten the stomach. It doesn't work. But they encourage you to do it like for 15 minutes every day for a month, and then
That's it, six pack.
six pack. It's crazy. It's just patience. And now, to be fair, there is research in this. So the main thing, obviously, is calorie deficit. To get rid of it, it's just sustaining in that calorie deficit, and going until it's gone, effectively. But there's a few things with that which I'll kind of go through with that. But there are things you can do that will, and it depends what we mean by stubborn belly fat. I mean, there's two types of fat. You've got obviously subcutaneous tissue, which is the stuff that's most people is what they're thinking about. So, the fat underneath the skin, that's what most people think about. But we do have visceral fat, which is the fat around your organs, which is, depending on where it is, can be more dangerous for your health. And that's why one of the things we look at is measuring like your hip to waist ratio, because it gives you an idea of where you store body fat. So for men, if your hip to waist ratio, well, for men and women, if your hip to waist ratio is above 1, so that is if your waist measurement is bigger than your hip measurement, then you are statistically at a slightly higher risk of things like cardiovascular disease, stroke, type 2 diabetes. Ideally for a woman, it needs to be below the number below 0.75. So if you measure your waist in centimeters, your hips in centimeters, divide waist by hip measurement. If the number is below sort of 0.75, then you are very low risk. If I think it's below 0.9 for women, then you are sort of lower risk. Anything above 0.9 for women is higher, and then above 1 for men is higher. So if you store your fat around the middle, then you are more likely to have that visceral fat. And there are so high intensity training, that HIIT training, is something that can help promote that sort of fat loss more than subcutaneous adipose tissue or fat tissue. So you can do certain high intensity exercises, but generally it is just a calorie deficit in a balanced diet. There are certain foods as well, so things like porridge oats or anything that contains beta glucans, that can help promote loss of visceral fat. I believe, and I'm willing to be corrected on that one, but I believe that's the case. But yeah, generally just staying in that calorie deficit. And I think the thing is, though, you've kind of got to, I know most people are like, they're after this kind of very flat tummy, defined stomach. And you've kind of got to think, how willing are you to sacrifice like
Yeah.
a lot of calories to reach. And I think we've said this before, it's that balance between, you know, being happy with yourself and being willing to, it's how much you're willing to sacrifice.
Yeah.
And a lot of people, you know, if you want to get that really flat stomach and defined six pack, it's no snacks, no alcohol, no socializing, really,
Yeah.
really strict in terms of the meals, strict in terms of your calories, and it takes a long time. I've
Yeah.
done it. It's hard, and it's not. I mean, there are some people who are really, really, really lucky and genetically don't store fat around the middle.
Yeah.
So they can have a body fat percentage of, say, 20%. Like for a bloke, they can have a body fat percentage of 20%. For women, they can have 20 to 25% and still have abs because they store body fat elsewhere.
Yeah.
They are lucky. Yeah. For most of us, you know, and certainly for myself, I tend to store my body fat around the middle. I'm currently sitting at around about sort of 18 to 20% body fat, and I haven't got abs. You know, that's where my fat is. I've got no fat on my arms. I mean, I pinch my arm there. There's literally nothing there. Um, Mine is all here, you know. And that's something else as well. You as you get older, so certainly for women, as your hormones change,
Yeah.
that's where your body fat is. It changes where your body fats are likely to be deposited. So, you know, as your hormones change when you enter perimenopause, you are preferentially going to start noticing body fat being stored there as
Yeah.
opposed to elsewhere in your body, you know, like your legs and your bum. So it's kind of another thing is look at how old you are and how your body's changed. Now, that's not to say you have to accept that that body fat's going to be there, but you also have to accept that it's going to be that little bit harder to shift, and you do have to kind of be willing to compromise, not just sacrifice, but
Yeah.
compromise on what you've got to do, I think. But yeah, in terms of best things to do, it's calorie deficit. You can target it a little bit with including some high intensity interval training, but then you don't want to do too much of that because of kind of, well, implications on sort of impact on joints, tiredness, all of that sort of thing as well. So yeah, it's including little bits of it, but strength train, calorie deficit, and just be patient.
Yeah. That's what it comes down to, isn't it? Just patience and just keep
Yeah.
going. You can't spot reduce it. Your body will be stubborn in its own way and it will come off where it wants to. But if you keep going, it will eventually go from those areas as well.
Yeah, and some people will lose it from there first, some people
Yeah.
lose it from there last, and it's just one of those things. And I think this comes down to something we've said before, is like, don't compare your journey with anybody else's. You've
Yeah.
got to, the only person you compare yourself to is yourself.
Yeah.
You know,
Absolutely.
take lots of progress photos. That's something that's become obvious. I mean, we had somebody in the WhatsApp group, didn't we, this week,
Yeah.
who's put a progress photo. She was beating herself up about, you know, not losing that much weight, but then posted the, like, just a month, and the
Yeah. Yeah.
difference is phenomenal. So yeah, it's patience, deficit, keep your steps up, strength train, and maybe if you want to, you don't have to, but if you want to, stick some interval training in there as well.
Yeah. Perfect. That
Cool.
brings us nicely on to the next question on HIIT training. Should we be doing HIIT training, especially as women? And should we be worried about how it's affecting our cortisol levels and hormones?
Yeah, so this was one that was asked to me in the gym, and I know where it came from, in that there's lots of stuff at the moment about cortisol, and I'm about to put an Instagram post up either today or tomorrow on that. There's a big thing on cortisol at the moment about how we need to worry about it.
Yeah.
The first thing on that is that cortisol is an important hormone. It's really important. It
Yeah.
helps us wake up. It gives us, it kind of helps control how energetic we feel. You know, and there are other processes that it's important for. If you have too much of it, then there are long-term health effects. But if you've got too much of it, that tends to be, it's down to your adrenal glands, you know, and there tends to be another issue there. It could be something like Cushing's, or and there's a medical issue, and you do need medical interventions for that. I have worked with a couple of clients who had that as a diagnosis, and there were specific medical interventions that I cannot remember for the life of me, but there were interventions there in place. It's not something that you treat with diet and exercise plans,
Yeah.
which I've seen loads of it. It crops up all over my feed, obviously, because I follow a lot of fitness influencers.
Yeah.
But it crops up all over my feeds where they're sort of saying, "Oh, you've got to tackle your cortisol. I did these things to tackle my cortisol." And then they sell you like a diet and exercise plan, which is pretty standard, and it isn't going to work. And there's no research to suggest that moderately elevated levels of cortisol are going to affect fat loss, are going to affect your health long term. And the only ways really you can reduce it is by managing stress. So things that cause cortisol increase, so things like anxiety, stress levels, lack of sleep, not being active, that can cause elevated long-term things. But being afraid of it, I mean, actually, if you're afraid of cortisol, you wouldn't exercise full stop. It's a stress hormone.
Yeah.
And when you exercise, you stress your bodies, and that causes that cortisol to increase, which is where the HIIT training comes in. So they'll say, don't do HIIT training because it's intense exercise and it causes the cortisol spike. And it's complete rubbish.
Yeah.
We shouldn't fear those spikes in cortisol because they're normal. It helps us, move more. It helps us feel more energetic, which is why we need it during exercise.
Yeah.
So the key thing there is, yes, do HIIT training. Actually, HIIT training has been shown to have benefits, and particularly for women who are going through perimenopause, but for all sorts of people, because again, it's one of those exercises that can help target that visceral fat.
Yeah.
So do it, but don't make all of your exercise high intensity.
Make sure you're mixing in some strength training with that as well, and some lower intensity.
Exactly.
But like I said, where it's leading into the cortisol at the moment, the massive buzz in the fitness world is around hormones.
Yeah.
And the way that it's being described with your cortisol levels is very similar to the crowd that are pushing how bad insulin spikes are.
Yeah.
It's very similar in that they're completely normal. It's your body's response to these things, and you don't need to be afraid of them. Our bodies have been spiking in different hormones, all sorts of different hormones in the body for years and years and years, and it's nothing to be afraid of. It will happen.
If we were constantly worried about keeping our hormones level, you're just the menstrual cycle, that's all about hormones fluctuating, spiking.
Spiking and fluctuating all the time. Yeah.
And if that didn't happen, then the human race would be in trouble because we would not be able to reproduce.
Exactly. Yeah.
So to fear, just to target certain, and I know where these things come from. There's like there'll be certain studies that show certain effects in animals in particular, but they'll have a mechanism that goes, oh, this mechanism might be interesting. Let's investigate it. And then all they do is they jump on that, especially with the insulin. They go, oh, insulin, if your insulin levels go up, it makes the body burn off the glucose and store fat. So you don't want insulin spikes because that makes you store fat. Well, yeah, it will, but in that short term, because once it's done its job and your glucose levels come down, your body then is going to go back to fat burning. If your goal is fat loss, calorie deficit is it. And if you are in a calorie deficit, then you are going to burn body fat, regardless of whether your insulin spikes or not. And they actually did a study in, I think it was Kevin Hall, who's done loads of really, really good sort of nutrition studies. He's the GOAT when it comes to nutrition studies. He is the godfather. Because he's got a facility where they do what they call ward studies, and they lock the people in for weeks at a time. And they basically go, right, we are going to control everything you eat. We're going to feed you. And they'll look at 2 different diets. And what they did for this, it wasn't specifically to destroy the insulin hypothesis, but effectively they did a low carb diet and a high carb diet.
Yeah.
Matched it for calories, they matched it for protein. The only differences was one was higher fat and lower carb,
Yeah.
and vice versa. They matched it for palatability as well. So taste, texture, all that sort of food. They matched sodium levels, absolutely everything was accounted for. They matched kind of activity levels. They made sure that everybody was in the same calorie deficit based on metabolic studies. And they basically found that there was no difference between the two. You know, if you ate carbohydrates and your insulin went up, you still lost the same amount of body fat. In fact, more body fat than the high fat, low carb diet. So it completely destroyed that insulin hypothesis idea that insulin's bad. And if you look in the real world, there are certain sort of cultures that have a high carb diet.
Yeah.
They've got lower levels of type 2 diabetes, lower levels of obesity, amongst other health markers as well, lower levels of cardiovascular disease. Yet they're eating a diet that is 75-80% carbohydrates, when by, according to the likes of Eddie Abu, oh no, you shouldn't be doing that. It's complete rubbish. So
Yeah.
this whole idea that we need to worry about these hormones, yes, if you are pre-diabetic or type 2 diabetic, and you
Absolutely.
have chronically elevated over a long period of time, there are issues. Absolutely. But for the average healthy individual, spikes are perfectly normal.
And so that is the same for all your hormones. They will spike at certain times. Like you say, cortisol will spike whenever you're doing exercise, wakes you up in the morning. It's helpful. So it's, again, nothing to be afraid of. Women can do HIIT training. But like
Absolutely.
say, just be mindful to mix it in with other forms.
It's as with everything, it's moderation. It's doing it to the level that suits you. I mean, true HIIT training's hard. It's intense, it's hard work, and your rest and recovery time can be longer. And especially as we age, and also as you go through things like the menopause, your recovery time can increase. And that's something to be mindful of, because if you do a really intense HIIT workout and then your steps drop off the next day, that's going to impact on your overall metabolic rate. So you do need to be mindful of that. But do it. Absolutely do it. And I think in 1 to 2 HIIT sessions a week is going to, no more than that, but that's really going to help benefit you. Yeah.
Absolutely. And then we've got certain medical conditions. Do they and can they affect fat loss? Is it going to be an issue? And how can we manage that?
Well,
as well.
You've been doing a little bit of reading on this one, so
I'll
let you take this one.
So this will be going out as a blog post very soon. This one will be finished in the next couple of days and then can go out. So yes, certain medications and medical conditions can interfere with fat loss. That can happen, just depending on what medications you're on, and what it is that you are facing. Really, they can have an impact, but that doesn't mean that fat loss is impossible, and it's not something to then be used as a barrier, or in a way sometimes an excuse to be oh well, I can't do it, so there's no point in trying. You can still manage your weight, even if there are certain things that you are suffering from. And the best thing to do is to first speak with your GP, and have that conversation with them to look at the impacts of that, to see where you're at and whether it's safe for you to be looking at fat loss at this time, with whatever it is that you are struggling with. And then definitely find yourself a good coach who can help you with that one. And this is where I guess it's then really important to be very mindful of, when you're looking at different coaching programs and people that can then help you with that, it's making sure that when they're looking at personalized plans, it is actually personalized, and you're not looking at these cookie cutter plans that are just giving you all of the same information, but they're just changing the portion sizes of your meals and things, because actually you will need that extra bit of support. So realistically, smaller group coaching, one-to-one coaching, or somewhere where it is actually fully personalized to you is going to be far more beneficial, because what you don't want is to make the mistake of working on a big online platform where you're maybe not getting as much tailored support as you would need, because it will be different. You may find your fat loss will be slower, With certain conditions like PCOS, like your normal range of calories that they may set you as like your deficit will be very different, because you can actually do better on like much lower calories than like your average individual. So there's things like that need to be taken into consideration, which they wouldn't necessarily do for you. So yeah, your first things is definitely speak to a coach, speak to your GP, and then finding a coach that will give you more of that personalized program and understands what it is that you are struggling with, what medications you're on, what your medical conditions are, to really help you as best they can.
And I mean, with the likes of things like PCOS and Hashimoto's is another one.
Yeah.
So what's the reason behind them making it harder? What's the main reason?
So now you're testing me.
Ah.
That's when it all comes down to like, so it's all like PCOS, especially in women, is all like, it's like, again, hormones and like issues that you've got like within the body. It's obviously harder to diagnose. It takes longer to diagnose as well. But yeah, it's obviously very uncomfortable, polycystic ovary syndrome. And yeah, it's all to do with the hormones in the body that are then causing those issues there. And like we said, hormones can have so many different impacts on like different areas. And yeah, but what it is it just, I think it's the weight gain is a lot easier, isn't it? And it's a lot more common in people that are slightly more overweight.
Yeah, and it's not the same. So PCOS, it's not everybody has the same symptoms. I mean, you've got like the trifecta of kind of the main things. So I think it's increased androgens. You can have polycystic ovaries without having polycystic ovary syndrome.
Yeah.
So you need, I think it's the increased androgens, so higher testosterone levels, polycystic ovaries, and I can't remember the third one. Is it insulin resistance?
Could be, yeah.
But you need 2 out of the 3 to be diagnosed. And the thing with, once you've got the syndrome, if you are diagnosed with the syndrome, it can cause a drop in your basal metabolic rate. And it's the same with Hashimoto's. It's to do with, I think it's to do with particularly the thyroid hormone.
Thyroid, yeah.
And it can decrease, depending on how severe, it can decrease your BMR by anywhere between 10 and 40%.
Which is a lot.
It is a lot. And if you think about, if you think about a woman who, say, is 75, 80 kilos and wants to drop, say, 10 kilos, the average woman who's, say, an 80-kilo woman, moderately active, you're probably looking at a daily energy expenditure of, say, somewhere between 2,200, 2,500 calories, with a BMR of around about, say, sort of 1,800-ish calories, sort of 1,700 calories. It could be that your BMR is as low as 1,200, and that your maintenance calories are only 1,500 to 1,600 if you've got these conditions. In which case, you can't just go, right, we'll stick you on a 500-calorie deficit.
Yeah, it's not going to work the same.
No,
with a lot of people, the reason that you look at the 500 calories is because that'll equate to like roughly £1 a week deficit. But like I say, that won't be the same if you're struggling with these conditions, because your BMR is so much lower. You would need to look at lower calories to account for that lower rate of BMR. So yeah, just to be able to put you in that deficit. So that's when actually these really low calorie diets can be helpful.
Short, sharp. Yeah,
that's when you need them.
There's been a couple, I listened to a good episode. It was Martin McDonald on it was a guest episode that he did on I can't remember the podcast. I follow the guys. Jamie Moran is the guy's name. I can't remember his Body Smart podcast, I think it's called. And he's talking about aggressive deficit, calorie deficit. And
I think I listened to that one the other day.
There's some really good science as well, some research behind. Now, we don't necessarily promote the aggressive deficit because it doesn't work for everybody.
It's hard.
It is hard. You're not hungry. I've done it myself. I've done it a few times. Actually, hunger is not the issue. It's the fact that you are, so if I give context, so my maintenance calories are somewhere between 3,000, 3,200. And people are like going, oh my God, that's a lot. Yes, it is a lot of food.
Lucky you.
But I'm somebody who works on the gym floor for
Yeah.
10 to 12 hours a day sometimes. I'm averaging sort of between 12 and 15,000 steps a day during the week.
Yeah.
I work out most days, strength train, and I've got a higher proportion of muscle mass compared to fat mass. So there are reasons for that. And I need that energy to fuel the activity that I've got.
Yeah.
When I do an aggressive deficit, I'm going down to say 1,200 calories. So it's a 2,000 calorie deficit.
Yeah.
Now,
It's a lot.
it's a lot, yeah. And actually, there are other factors in there. So Martin McDonald talks about there is a limit to how much body fat your body can actually burn.
Mm-hmm.
There is a limit to the rate. So if I go into that 2,000 calorie deficit, I am actually greater than the rate that my body can burn body fat, and it will use other tissues as well. So I do have to be careful with that. But at 1,200 calories, I'm not hungry.
Yeah.
I have a really high protein diet with there, but it is literally, it's chicken, it's veg, and that's it.
Yeah. And like we said before, that volume eating is what's going to keep you full. When you have got less calories to play with, it's the volume foods that are going to keep you full. And like you say, your lean sources of protein, your fibrous veg, that's what will keep you going. But
But
yeah.
with that diet, there's absolutely no alcohol, no
Oh
socializing,
yeah.
no
You've got
chocolate.
no
So
room for it.
it's hard, but you
Yeah.
don't do it for very long because it's very high protein, it's very low carb, low fat. You don't do it for very long.
Yeah.
Because there are health implications there. So you do it for maybe 10 to 14 days, and then you eat closer to maintenance for a week or so, and then you can go again. So you can do that. So if you have something like PCOS or Hashimoto's, that could be an option. But like you said, if you go into a large scale group coaching fat loss program, they're just going to say that they'll ask you for medical conditions. If they're any good, they will say, are there any medical conditions that we need to be aware of?
Yeah.
And you'll say PCOS or Hashimoto's or whatever, some sort of metabolic disorder, and they'll go, right, in which case these are your calories. And then that's it. They won't necessarily sort of give you the support around, well, look, actually, this is your maintenance. Therefore, we're not going to give you the standard calorie deficit. We're going to drop you down, say, 10% instead of 20%.
Yeah.
So your rate of fat loss is going to be lower, and you have to accept that because you've got to be patient.
Yeah.
But yeah, ultimately, yes, there are conditions that can do it. Yes, there are medications. I mean, we didn't really cover medications there, but they can impact on your fat loss. But ultimately, it's still the calorie deficit
that will make the difference.
Yeah, the only impact that they have for your medical conditions, they can lower your BMR, so it makes it slower and a little bit harder. And then some medications, they impact on your appetite. They can make you, so things like some antidepressants can increase appetite in some people.
Yeah.
That makes it harder. In which case, we go back to what you just said, volume eating.
Yeah.
Volume eating is your friend. So lots of veg, lots of low carb fruit, so your berries, high fiber fruit, berries and things like that. Lots of lean proteins, and then complex carbs and grains for the fiber and the carbs. But yeah.
There you go. And then the last couple we've got is we have got how to manage symptoms from when you're eating protein and how it's impacting. I think
I saw the emojis on this one.
The emojis with this one, we're thinking like bloating, gas, all of those symptoms that can come from excess protein.
So with protein, it depends on the type of protein. So
absolutely,
there's protein itself doesn't necessarily cause wind and that people kind of say, oh, protein trumps protein farts. Protein itself doesn't necessarily cause that issue. It tends to be the other foods. So if you're eating protein from whole food sources, it tends to be the other foods. Look at the sources you're getting it from. So for example, if a lot of your protein is coming from dairy sources, so your Greek yogurts, milk, low fat cheeses, whey protein powders, that sort of thing, protein puddings and things like that, then it may be that you've got a slight intolerance, lactose intolerance, dairy intolerance, or just that you can't tolerate large amounts. It's not that you should avoid it. It might be that it's like, look, you just can't tolerate a lot of that sort of stuff.
Yeah.
So look at other sources. So lean meats and things like, so, chicken, lean fish, lean meats like your lean beef and stuff, and get it from a variety of stuff. Look at your fiber intake, so protein can sometimes have the impact, like when people suddenly increase their protein in the diet, they might notice that their bowel movements slow considerably because protein does slow down transit through the digestive system. That's why it keeps you feeling fuller for longer. So, maybe having some more insoluble fiber, so roughage, that's where your whole grains come in, where your leafy greens and that sort of veg comes in, making sure you're getting a good amount of that just to keep everything moving. And again, I think a lot of it, when people suddenly start eating a high protein diet, they change a lot of other habits around the diet.
Absolutely.
And that's going to impact on kind of how and it's just persevere. It's just like, right. I had a client, a newish client, a few weeks ago, and we looked at their proteins, and then all of a sudden, I sort of said, right, we're going to increase your protein in steps. She was eating about 50 grams of protein a day, not enough. So we said, right, we'll try and increase it to say 70, 80 grams a day, and then maybe go for 90 and then 100. First week, straight up to 100. She was putting protein powder in with the porridge. She was having chicken for lunch and dinner. And she went from like 50 to 100. And she's a small framed woman as well. And then I get a message a week later going, I've not been to the toilet for 3 days. I'm feeling really bloated. And then when I looked at the diet, it's like, this is why, you've suddenly gone from here to here with your protein. We need to step it up. And we knocked it back down to where it was, left it a few days, let the digestive system normalize, and we brought it up gradually, and we built it in, and we looked at sort of say, right, just with your lunch, add a bit more chicken, keep everything else the same. Then with your evening meal, add a little bit more of the chicken's the only meat she ate, which is, I'm not suggesting everybody eats chicken. Chicken was the only
That
meat.
was her choice.
So it's like, just add a little bit of more protein of what you eat to lunch. Then we add on to dinner. And then we can look at what we can do for your breakfast to increase it till we hit that 100. Now she's there, we're now sort of 4 or 5 weeks on. We've built it up, no issues. So it's looking at, if you've suddenly changed the diet, that's one thing. The other thing as well, if you're getting your protein from things like protein powders, protein puddings and yogurts, protein bars, some of the protein sources that they add into there is going to have sweeteners and what we call sugar alcohols in there. That could be something that causes bloating as well. So I know that I don't digest maltitol, which is one of the sugar alcohols, which is in a lot of protein powders, because it's cheap. And what I have to do is look at the ingredients. So if it contains that, I can have maybe 1 scoop a day and I'm fine. Anything more than that, I'm going to be winded. So I look at the different. So one of the things I've also started to do is look at casein protein, which is a little bit more expensive, but it's a slower releasing protein. And again, it tends to have less of those kind of sugar alcohols in. But or you can look at things like whey isolates, which
I was going to say, whey isolates is another good one.
So your clear whey proteins are good for that. But it's just look at your protein source, I think, and then variety, get more variety in there, and then look at your fiber intake, making sure that that's good enough. But again, don't just go from 0 to 100. Increase
Absolutely, build it in gradually. Because it's the same as if you're looking at like vegetarian source of protein. If you suddenly increase your legumes, and all of that sort of thing, they're also higher in fiber. So you may find that it just takes a little while for your digestive system and your gut to sort of catch up with everything else.
We come back to that phrase of patience. It's these things. It's the same with anything. People go, "Oh, exercise, I feel sore." When you do it a bit more, you'll feel less sore.
You won't feel it all the time.
Your body gets used to it, and it's the same with this diet. I'm working with somebody who's got ulcerative colitis, and we're slowly she's under medical supervision. She's gone through an elimination diet. So she's brought everything back down to really plain, simple food. So white bread, white meat, white grains, and really simple veg. So no cruciferous vegetables, no cauliflower, broccoli, and stuff like that.
Yeah.
Just dead basic. And then gradually we're adding stuff in. Now, this is a process. She's been with me 2 months, and we've managed to bring in a few of the cruciferous vegetables again. So, avocado. She's eaten avocado for the first time last week, and
Oh,
and it's like she loved it. And it's like, yeah, we'll bring avocado, and it's a high fiber food, so we have to watch it. So
yeah.
small amounts, but that's the thing. You've got to do it over time.
Yeah.
Our gut microbiome is such a complex system that any changes to your diet is going to impact on it.
Yeah.
And, if you go into a calorie deficit, that does impact your microbiome because we change the foods that we eat. We don't, we don't know how it changes it, whether those effects are positive, negative, or neutral. The chances are that they're going to be neutral or positive.
Yeah.
But every time it's changed, it's going to cause impact, and you've just got to give your body time to adjust, let it settle, and then it'll be all right. So yeah, just be patient.
Again.
Yeah, be patient. So it's variety. Look at
Yeah.
variety. Give your body time to relax and to respond and settle. And it may well be that if you keep everything consistent, it sorts itself out, and the bloating problem and the wind problem might just go.
Yeah.
If not, look at where you're getting it from and the amounts of certain types that you're eating.
Yeah, absolutely. And then one final question is getting over that mental block and the fear of lifting heavier weights.
This one is, now I know I've already answered this one to Katie, who mentioned it, but it's a really good question, and it's something that it's so common. I mean, I get this all the time from people in the gym, sort of, oh, I can't break through this. They kind of hit a weight that they can't break through.
Yeah.
And I've come across it myself. When I sort of gave the answer to Katie, my example was me. So when I did deadlifts, I quite quickly got up to quite a heavy weight. And then I hit like a four plates either side, 180 kilos. That's kind of one of the first goal weights that people try and aim for. And I was stuck at that. I could lift 180 kilos, could not get any higher. But I think one of the things, again, it does come down to patience. So we're constantly trying to push every single week, and that's what we want to do with progressive overload. But we need to understand that sometimes you're just not going to be able to lift heavier every week. And it's perfectly normal for that weight to kind of plateau for 4 weeks, 8 weeks, even 12 weeks at a time. And what you've got to do is look at other ways of progressing it. So look at your how many reps you can do. So she might be at a weight where she can do, say, for example, a leg press. She's at, say, 150 kilos and she can't go any heavier. And she's, she might be, I'm doing 8 reps at 150 kilos, but I can't do any more than that. If I stick it up to 160, I really struggle.
Yeah.
So, okay, stick at a weight that you can do.
Mm-hmm.
And build on that. So you can do 8 reps, do 10, do 12, do 15. Yeah. Obviously, you don't want to go up to like 25, 30 reps because your workouts are going to be lasting like 2 hours. But you go up to, say, 15. Once you've hit that, then you can slow it down. You can look at decreasing the tempo or increasing the negative part of the lift. So as you lower it down very slowly, maybe even push it up slowly so that you're making the muscles work harder. You can decrease your rest time. You can increase the number of sets that you do. But effectively, what you're doing is you are increasing the amount of effort your muscles have to expend, and put in. And then the other thing is, look at what jumps you're looking at. So if you're going from, let's say, if we pick something like the shoulder press and you were going from 10 kilos up to 12.5, that's quite a big jump.
Yeah.
And dumbbells, it's quite difficult. Unfortunately, I haven't got 10 kilos, 10 and a half kilos, 11 kilos.
Yeah.
So that's where you would have to push the reps up and then slow the tempo down, maybe decrease your rest times, increase the sets. Once you're confident, let's say you can do 4 sets at 15 reps with a slow tempo with short rest times, then you can go up the next weight. Yeah. And you'll find that it's a lot easier. If with things like the leg press, where you're trying to go from 150 to 160, stick a 1.25 each side.
Yeah.
Do one.
It's still an increase.
Yeah, 152.5. Because if you were doing that on your leg press, if you were adding 2.5 kilos every week,
yeah,
in a month you've added 10 kilos.
Yeah.
You know, in 12 months you've added 120 kilos. So it's like, so it's again, it's just kind of build it up slowly.
Yeah.
But yeah, I think a lot of it's mental.
100%. Yeah.
You know, and you think about yourself when you've done deadlifts or
well, I had it with you when I came and trained with you and we did deadlifts, and I could have, like, 90 kilos moved so easy, but as soon as we tried to do the 100, it was in my head like, this is 100 kilos.
Yeah.
That I should have been able to move that easy, and I just couldn't.
Yeah. And I've had it myself. So
yeah.
I hit a plateau at 200.
Yeah.
I stuck 2.5 kilos either side, which is nothing. It's, you know, it's a
You could have done it. Yeah.
But because I've got that in my head that there's an extra 2.5 kilos each side,
suddenly it's not
comfortable.
Yeah.
So with that, what I then did was I went back to 200, which is a weight I know I can lift. And then I did, you know, instead of doing 1 rep max, I did 2 reps, 3 reps, 4 reps, and 200 kilos, I could do 5 or 6 reps. Then I moved it up, and then I did the same thing there. Yes, it takes time. So I come back to that word, patience, and be consistent. And this is why it's really important as well to track your workouts. You know, this is why when we do the program, they record what they've lifted on the app. And then each week they try and either do 1 more rep or lift a little bit more weight. If you don't track your workouts, you don't know.
There's no way I'd remember what I'm lifting every week on every single exercise. Like, it's just impossible. It's nice to see the progress as well. I think that's the other thing. And the other thing, like I say, with the lifting heavier, it's not always like, one example for me at the moment, it's my RG dumbbell RDLs at the moment. But it's not a cat that I couldn't do it from like a physical point of view. It's the grip. Like, my hands aren't strong enough to hold like bigger dumbbells. So that's the way, like, say, you can look at those other ways to make that exercise harder. Because you will hit those barriers, and like you say, there will just be times, and it happens to everyone. But like you say, there's ways that you can increase it, because once you can do 15 reps of something, that gives you that confidence that, like, there's, of course I can do, like, even if then, like, say, you up the weight but just do 4 or 5 reps.
You can do it.
You can then build on that again.
It's working on the form. Another way to progress, that you could do it with better form, you know, and doing it that way. And the other thing is, as long as you are going close, it doesn't matter how heavy you're lifting. If the goal is gaining muscle or maintaining or building muscle, then as long as you are going close to failure, you know, within 2 or 3 reps of failure, then it doesn't matter what weight you're lifting. You are still going to cause the muscles to adapt to that. You're giving it that stimulus to build. So you know, if you're worried about breaking through that weight plateau and you're thinking, I've got to go heavier, get rid of that thought. Right? If the goal, look at what your goal is. If your goal's strength, if you're a power lifter and it's strength, then of course you want to lift heavier weight.
Lifting heavy,
then you can do all those things. We can, you know, you can add pauses in. So one of the things I did was add pauses into the deadlift at strategic points. So I'd pause just off the floor, I'd pause at the knee, and then up. So you can do that with a squat. You can pause at the bottom before you lift. If you're doing bench presses, pause at the bottom and then drive up. But if the goal is just to build muscle, then the weight doesn't matter. As long as you are using a weight where you can go close to failure within, say, 2 or 3 reps of failure, you are going to give the stimulus to the muscles to grow, and that's it. But I know everybody wants to be able to lift more. You know, we all do, which is fine, and it's a worthy goal. But don't make it be the be all and end all. Yeah, absolutely. There we go. Good one to finish on. Yeah, all done. Really good. All right. Well, we will be. I'll get my teeth in. It's 9 o'clock. We will be back next week, and hopefully with some more good questions. But until then, have a great weekend. I'm hoping the sun's out this weekend.
Fingers crossed. I'll be working, so it'll make no difference. But yeah, hopefully for everyone else, the sun will be out.
Yeah, so I'll go and enjoy the crazy golf at Glory Holes.
Yeah, well, yeah, you have a very fun weekend, Will.
Yeah, the stuff that I get up, no, it'd be good. It'll be good. I'm looking forward to that. It'll be interesting. I've not been in there. We went to one called House of Holes. I think I've told you about House of Holes, haven't I? House of Holes is the other one. That was it's a crazy golf nightclub, adults that 18s and out. Yeah, it's got a lot of sex toys all over the place, which is an interesting one. The obstacles are sex toys, so that you have to navigate. Yeah. So I'm thinking that Glory Holes might be similar.
Now we know how Will spends the weekend.
Now we know how I spend the weekends. I was going to say something along the lines of I'm sure Rosie would enjoy it, but I think people might take that the wrong way.
As long as you have fun.
And on that note, before we start to descend into depravity, I think we'll leave it there. All right, guys, we'll speak to you next week.
Bye.
Bye for now.